Hello and welcome to the speaking role play. The speaking role play that we'll do first is on nursing, and the setting is Community Health Centre. So my name is Daljit Rao.
And my name is Mercy Pushparaj.
Thank you. And we will start the role play just to give you an idea as to how we are approaching the role play. I will take the role of the examiner as a patient, and
I will take the role of the community health nurse. That's the candidate.
thank you.
Okay, so let's begin. Hello, hi, good afternoon.
Hello.
You are Ruby, is that right?
Yes, that's right.
All right. Okay, Ruby, may I know the reason for your visit?
Look, I'm experiencing some panic attacks, and I'm having this sharp pain in my chest. And I thought, maybe I should just come in and get some advice.
Okay, Ruby, you said you're getting sharp pain in your chest and discomfort, if I'm right. Is that-
Correct.
Okay, how long does this last?
For a short while, but I think it's when my anxiety level is up. I find I have episodes of shortness of breath,
Okay.
trembling, and just I can hear my heart pounding so loud,
Okay.
and very sharp pain in my chest.
Okay. It must be difficult for you.
So as you said, how long? Probably about 20 minutes.
20 minutes.
Yes.
Okay. Quite some time for you to go through that. And Ruby, also, have you had anything like this in the past?
No, but look, I'm very anxious at the moment.
See that.
So, and that's why I got very concerned, and I thought I'll come and see you.
All right. Can I ask you a few things before we proceed?
Sure.
That'll help me help you.
Mhm.
All right, Ruby, do you see that there's anything that's causing this kind of an anxiety that you're talking about? Anything that has triggered this? What has happened before you got these episodes?
Well, I'm very anxious because I've got my exams coming up.
All right, talk about it.
And which is in 2 months' time, and it's a big one, and I need to do well.
All right, Ruby, now that you've spoken about exams, it gives me a little bit of a relief, because as much as it has been worrying you,
Yeah.
I think it is a normal response to exams, feeling fearful, anxious, or nervous. Good news for you is that it is a normal reaction to exams, or normal response to this exam fear.
Right.
And
So it's okay to have a panic attack? Is that what you're saying?
it's all right, because it is a normal response given to understand that you have exams, and it's common before exams. And the nicer thing is that it can be handled, it can be
Oh,
reversed.
so it's not serious then.
Definitely not. Definitely not.
I'm relieved. I'm relieved.
Also, Ruby, I'd like to suggest a few things that I feel should really help you. And the primary thing is self-care. And the first step that you've taken to come here and get some help is the first step towards healthcare. And to talk in that direction, I think you should just, when you're feeling very anxious, when you're getting these symptoms, I think you should just move to a quiet place.
Right.
Also, I think begin to visualize things that otherwise give you a lot of peace.
Okay.
And maybe practice a few more healthy habits. Maybe you do, but these are suggestions, like resting sufficiently. Sometimes we tend not to sleep enough before an exam.
Oh, well, that I'm going through as well, but I like some of the strategies that you have told me, and I'll definitely take that up
It's nice.
with what you're saying, because I do need to sort of calm myself down as well.
Definitely you do. And moving, like I said before, moving to a quiet place, getting enough rest, eating sufficiently, eating nutritious food,
Right.
keeping yourself hydrated. These are things that are going to add to reversing this anxiety.
Okay, right.
And I would also suggest that since you've already come here, we may have to see you a couple of more times. And I suggest that you visit the community health center every week. We could work on learning some exercises,
Right.
breathing and relaxation probably. And I think you should be through.
All right. Well, look, I think it sounds like a good idea what you're suggesting.
I'm glad you
That
like
is
it.
that, to come in here and see you every week, it might just help with my anxiety as well.
Definitely it will. It's only a mild normal panic attack in response to your exam. And I think, Ruby, you should be doing well. And good luck with your exams.
Thank you very much. Do you want to conclude?
All right, so that was the end of the role play. And like you saw, that I had taken the role of the community health nurse to begin with, to start off, where we start with understanding the concerns of why the patient has come to you, and then begin to put yourself in their shoes, and then understand where they really need suggestions, and arrange it in chronological order, and then round it off by giving them a solution that's midway. And yes, I think you finished the 5 minutes effectively in that manner.
And so, what also Mercy tried to do was give me some comfort, assurance, showed some empathy as she went along as well, telling me that to stay calm and to do the right things. And I was very comfortable by the time I finished that role play with Mercy. Thank you very much for listening to the nursing role play, and we hope that you have gained some information tips out of this.